My orthodontist and my general dentist both let me know to get my wisdom teeth taken out.
When she was in for a routine examination, it was noted that one of her wisdom teeth was starting to attempt to erupt into the mouth. Her dentist also noticed that, when he took the x-ray, that she had the other 3 wisdom teeth, which were not erupting yet, and they were coming in at angles that were such that those teeth would never be viable teeth in the mouth.
The doctor explained it very well. He sat down with me, looked over the x-rays with me, showed me exactly what may be a problem with her wisdom teeth and what may not be a problem, and just described exactly what he would do during the surgery.
If left untreated for years, decay can develop in the tooth due to the fact that it's partially erupted, difficult to maintain hygienically for her. When decay develops in the tooth, then the risk of infection in the jaw and the surrounding soft tissues, the face and neck, is there.
My AAOMS described to me how the surgery would go. I was just kind of sitting there ready to get it over with, but he made it very comfortable for me. I felt very safe and everything, even just right walking in, everybody welcomed me with a smile.
As an oral and maxillofacial surgeon, I treat patients with wisdom tooth problems every day. I let them know, first of all, you can do this one of 3 ways. We can do it with a local anesthetic. We can do it with nitrous oxide and local, or we can do it with an IV general anesthetic. And then we remove the teeth surgically. Depending on their position, we may have to make some incisions to get to them. Sometimes we have to remove a little bit of bone around the tooth to get it out in order to not damage the adjacent teeth that we're trying to preserve and keep healthy. And there may be some stitches in there post-operatively.
So right after I had the surgery, I basically slept for a few days and I enjoyed the foods that I got to eat, lots of Jell-O, mashed potatoes, ice cream.
I strongly encourage my patients to start with ibuprofen or naproxen. The non-steroidal anti-inflammatories they've been proven to be the #1 thing to manage the pain. And I think that's another thing that we try to convey to the patients, that you are going to have some discomfort with this, but it's not going to be terrible.
It took about a week and a half until I could just get back into my normal routine.
I tell them to limit their activity, definitely, for those first 48 hours. Beyond that, I tell most patients that you can get back to school or work as long as you're not doing strenuous physical activity for about 5 to 7 days. Because we don't want them obviously bleeding again and potentially leading to some of the more common complications that are immediately post-operative.
If somebody has to get their wisdom teeth taken out, I would tell them to relax and don't worry about it, because personally I overthought everything and I was a little scared, but overall my experience was the opposite of that. It was actually very comfortable.